discuss that if we have time at the end of this session or at future sessions. But for now, I'm delighted to introduce Professor Anthony Costello. So among a very long list of roles and achievements, Anthony is former Director of Maternal, Child and Adolescent Health at the World Health Organization and currently plays leading roles in the Lancet Countdown on Health and Climate Change and the WHO, UNICEF and Lancet Initiative on Children in All Policies 2030. Thank you so much for joining us, Anthony, and over to you.
I hope you can see that and I hope you can hear me. Thanks very much, Dougal. Thanks, Peter, as well. I'm going to make a few comments about challenges and opportunities specifically around adolescent health from both the UK and also a global perspective. And the first comment is, why is adolescent health so neglected? I think part of it is there haven't been coherent frameworks about adolescent or children and young people, if you like. And this one on the right comes from the Partnership for Maternal Newborn Child Health, which I quite like, about well-being and obviously health and nutrition, but also connectedness, positive values, safe, supportive environment, educational aspects, and very importantly, agency and resilience and the links across society. So this is a very important framework, and you'll find others as well. But what always astonishes me is why this is neglected by funders. And there's no real understanding of the window of opportunity, not only to tackle adolescent problems, but also massive adult health problems with potentially huge economic benefits. And I won't read through that list, but you can see it's a massive list where behaviors between 10 and 19 could have a very enormous impact on the prevalence of both disease and antisocial behavior. Another, of course, is that adolescents are hidden from view. You know, I've had 3 in my family. They're now in their 20s and 30s. But this diagram from the Lancet Adolescent Health Commission shows you what I discovered, which is from about 11 onwards, children become much more focused on their peer group and on their phone or social media, and you don't often know what they're up to. And of course, that's both a challenge, but also an opportunity, because both peer groups and media through mobile phones could be a route into children in a way that could be positive. The big problem is, and I sat through meetings at WHO and so many meetings over about 10 years where everyone said, oh, adolescent health is so important. And then when the funding decisions are made, everything is focused on basically condoms and contraceptives. And it's all about stopping STD. This is the World Health Organization page about adolescent health. But again, at the bottom, they're trying to sell preventing pregnancy. And I think adolescents are much more than that. They're like the rest of us in our early years. And there are many more concerns than condoms and contraceptives, important though those are. This is a rapid intuition appraisal that took me about 45 minutes, which I did a few years back when I thought about all the friends of my children. And I worked out that of about 45 I listed in my children's networks, 2 had had manic depressive episodes. 1 boy had been psychotic, 3 self-harmed, about a quarter smoked. All of them virtually were drinking too much, in my estimation. About a third were overweight, obese. 2/3 I didn't think were exercising enough. And 3/4 of them certainly had periods of anxiety and distress over that time. None of them had been pregnant, of course. 3 were gambling semi-professionally, and I didn't know about the other stuff. So this is a big issue. And actually, one of my daughter's friends who became a teacher at the age of 25 told me that every day at school, a North London Comprehensive, she would spend 2 hours after school talking to students. She said it was a massive issue because she was the youngest teacher, about all these issues, whether it was stress, self-harming, eating, drinking, being a refugee, divorce, parental pressure. And of course, globally, we know that 1.2 million adolescents die each year. This is not a trivial sum. Road injury being the main cause for boys, and girls still, sadly, maternal issues and self-harm and suicide. And that's why we need to think about them, children, young people, adolescents, in all policies. And this was the main conclusion from the Lancet Commission that was published 2 years ago. You can download A Future for the World's Children. This was jointly with WHO, UNICEF. And I'm not going to go into that, but subsequent to that, first, the key issue from that was that in every sector, I mean, if you go to the transport ministry, road injury is the leading cause of death for young people. Agriculture and trade will affect either malnutrition in the poorer countries or obesogenic diets. Urban planning, 90% of children also breathes unsafe air. And if you look at family services, 40% of children live in informal settlements around the world. And we all know that education is not just about turning up at school, but whether you get some kind of quality education. So these are massive cross-sectoral issues, as Peter mentioned at the beginning of this program. And we have to think about that. Since that commission was published, we've set up something called Children in All Policies 2030. And we think that's important, and 9 countries are involved, and WHO and UNICEF support this. If you want to read more, go to that website, cap-2030.org. Next, I would say we need trials. If you look at the International Clinical Trial Research Program list, that little blue dot in the middle is adolescent health. So very few trials in relation to many other biomedical issues are done. We need trials because they can have impact. I think we need large trials. And if there's very limited amounts of money, because public health rarely gets more than about 4% of all medical research funding in this country, with more than 90% going to biomedicine, which I strongly disagree with, but that's another issue. We need to choose a variety of outcomes. I've listed some there. We can think about both peer group as well as individual interventions, and we need to do economic analysis. So I think if we were going to spend money on this, it'd be better to do 2 or 3 large trials and have a lot of people like you doing smaller sub-projects as you go along. Climate change is massive. Children are very worried about it, as we all should be. But I think we can turn them around from being protesters to participants. And I'll just tell you about one issue that we're involved with at the moment. We've done pilot work on this, looking at school children and adolescents acting as citizen scientists, collecting information on their mobile phones about their local ecosystems. This is in the Middle Hills of Nepal, where landslides are a very important contributor to not just accidents and death, but to damage to agricultural land. And ultimately, what we want to do is to do a trial of this at scale, where we look at outcomes not only for child nutrition and dietary diversity, but also for land health, looking at green cover, water cover from satellites, and also soil carbon, which is important for future investment. Last couple of points, tap into creativity. You know, teenagers are incredibly imaginative, creative, artistic, enthusiastic, and passionate. They really love to learn and be involved. There's lots of things that you can get them involved with. I shouldn't say this, but they're also very cheap. So that if you've got big projects and stuff, they'll happily come and get involved. And it's not going to cost you a fortune, although I do think they should be rewarded. Finally, I mean, as you know, health is political. I'm not saying party political, but it is fundamentally about power and voice. And it's also about what goes on in the international scene. So adolescent empowerment is very important because it embraces changes in agency and her social environment, for example, for speaking out, for also giving them a sense of purpose and meaning when so many are individually stressed. And I'll just, you know, my youngest son was at Bristol University, and during his time there, 11 students committed suicide, which I think is a scandal. And I think there are issues that we could be dealing with through peer groups for that. Finally, this was when we put the child obesity strategy through the World Health Organization. I assumed that it would just be endorsed by everyone. It struck me as very non-controversial. But at the main meeting, there were lots of voices of dissent. So we were sent into another room where we spent 6 hours going over every word of an obesity strategy. And in the end, 2 countries refused to endorse it. A certain USA, which refuses most things, and secondly, Italy. And at the end, as I was then the director, this was about 4.5 years ago, I had to go up to the main. I saw my opportunity because the DG had gone out the room, so I sat there to get my photo. But I had to feed back on this, and I was somewhat less than diplomatic. And at the end, one of the American delegation came up and said, "Dr. Costello, I found your presentation very patronizing." And I wanted to say, well, actually, it's pronounced patronizing and it means speaking down to people. But I didn't, because I was then a diplomat and civil servant. But I'll stop there. I hope that's a few ideas. And I really do hope some of you will get involved in adolescent health, because I think it's an incredibly neglected and important area. Thanks.